afternoon, everyone, and welcome to the Grey's Anatomy podcast series, episode 29. Today we welcome special guest Mandy Mandeville to join us in a discussion of streptococcal infections. Today we will specifically be talking about the most common infection, strep throat, but we will also mention the other types of streptococcal infection as well. I will begin by telling you a little about exactly what streptococcal infections are. They are a group of microbial similar pathogens that have unique characteristics and can cause a variety of infections. They are categorized into groups A, B, C, D, and G. Groups A, B, and D are the most common, and again the most common infection overall is pharyngeal infection from group A, which is also known as strep throat. This is what we'll focus on for the rest of our discussion.
That's fascinating, Alyssa. Can you tell me about the transmission of strep throat?
Well, Mandy, strep throat can be transmitted through inspiration of respiratory droplets, through touching an object with the droplets on it and then touching your mouth or nose, or from drinking from the same glass or eating from the same plate as an infected person.
What are some of the signs and symptoms of strep throat?
Signs and symptoms of strep throat include a bright red pharynx, fever, sore throat, pain with swallowing, red and swollen tonsils, sometimes with white pus or spots, petechiae on the roof of the mouth, headache, stomach pain, nausea, vomiting, lymphadenopathy, and tonsillar exudates.
Now, who can be affected by this infection?
Anyone can be infected. However, there are risk factors that can increase your chance of infection, including close contact with another person with strep, children 5 to 15 years old, parents of school-aged children, and adults who are often in contact with children.
Now, Alyssa, if I think I have strep throat, how would a doctor diagnose it?
Well, a doctor would perform a strep test throat culture or a laboratory blood test. Blood tests showing a white blood cell count of 12,000 to 20,000 microliters with 75 to 90% neutrophils is indicative of strep throat.
Wow, how would I treat strep throat?
Strep is treated with antibiotics, usually penicillin or erythromycin. Just remember that it's very important to complete the entire course of the antibiotics. Also, you should handle any materials soiled with residue from the infection or infected person as infectious waste.
That sounds complex. How can I prevent getting strep throat?
Well, you can help prevent strep throat by using proper sanitation and personal hygiene techniques. You can also isolate the contagious person until their period of communicability has passed.
Thanks for all this information, Alyssa. Do you have any further statistics about strep throat and streptococcal infections?
Of course, Mandy. Here are some fun statistics. Between 4 to 6 out of every 20 children with a sore throat have strep throat, while only 1 to 3 out of every 20 adults with a sore throat will have strep throat. Also, children and teens can acquire a rheumatoid fever if they don't get strep treated. Other types of streptococcal infections include Group A illnesses, such as tonsillitis, impetigo, myositis, pneumonia, toxic shock syndrome, cellulitis, rheumatic fever, acute post-streptococcal glomerulonephritis, and streptococcus. Group B illnesses include endocarditis, septic arthritis, postpartum sepsis, neonatal pneumonia, and Group D illnesses include bacterial endocarditis, UTIs, abdominal sepsis, cellulitis, and wound infections. Thanks for joining us today, Mandy. We will see everyone next week for episode 30 of the Grey's Anatomy podcast series.